Niall Dickson, Chief Executive of the NHS Confederation, which represents organisations across the healthcare sector. And Niall Dickson, obviously a lot of sorrow, a lot of anger at what's been happening with the deaths of healthcare workers. I mean, what are your thoughts about the government action, the idea of this assurance scheme?
Well, this is something we've been calling for. There's already, to be clear, a death in service payment to anyone who's part of the NHS pension scheme. So this is on top of that, as it were. But and importantly, it'll cover staff who are not members of that scheme. And that might be some support staff who may not be directly employed by the NHS, cleaners, porters and people like that. And of course, those working in social care as well, who would not normally be part of the NHS scheme. So, and this 60,000 amounts to roughly twice the average salary. So we've been pressing for it behind the scenes, and we're very, very pleased that at least this has been introduced as one small recognition of the additional risk which staff who are on the front line are facing at the moment.
I also wanted to ask you about the fact that the NHS is going to be starting up some vital services in areas like cancer care from today. Hospitals are able to do that, are they?
Yes, they are, and I think leaders across the country, across the whole of the UK, frankly, are starting to think this stuff through. We've got a situation where the NHS has completely transformed. I mean, it's done what everybody said was impossible. You know, in England, they've closed 33,000 beds alone. Now you have to think, how do you take that back to something that is good and is dealing with all the pent-up demand? And I think there are risks and opportunities here. The risks are the obvious one, you know, like social distancing. We underestimate the virus, we go too far, and we don't retain the ability to treat considerable numbers of extra COVID patients. And secondly, I think we need to make sure we don't gear up one part of the service, for example, hospitals, and ignore the fact that that has a massive knock-on effect on ambulances, on community and GP services and social care. But the opportunities are really fantastic. And the one thing you get from across the service is how much things have already changed. So apart from remote working, so great advantage. Outpatients will never be the same again. There are new ways of working. There's better flow through hospitals, how they discharge. Things in the community I don't think will look the same either. So we're seeing new services that have been talked about for years suddenly coming into place. So it's a very exciting moment, but everybody wants to talk about reset rather than recovery, because as somebody put it, we don't want to go back to where we were, we want to go back to where we want to be.